All right, today we're putting on our detective hats. We've got a real medical mystery on our hands. Two different patients, but their symptoms almost identical. And we're going to solve this puzzle together, one clue at a time, to figure out how one path leads to a treatable disorder and the other a deadly cancer. And this is really the heart of it all. It's the question that keeps doctors up at night. When all the signs seem to be pointing down the same road, how do you find the right turn? Because for the patients we're talking about, getting that answer right is everything. Okay, let's start our investigation. You know, in any medical case, it always begins with the patient's story, the symptoms. And in this particular mystery, the symptoms our two patients are sharing are, well, they're dangerously misleading. Now, here's the tricky part. Look at these clues. We're talking about a fatigue that's just crushing, weight loss that you can't explain, swollen lymph nodes, and these drenching night sweats. In medical terms, these are called constitutional symptoms, which is really just a fancy way of saying your entire body is sending up a huge SOS flare. The problem? That flare could mean almost anything: an infection, an autoimmune disease, or cancer. This is the fog we have to see through. So let's follow the evidence, starting with case number 1. We're going to look at the patient's unique clues and that first round of lab work to see how this investigation starts to peel back the layers and unmask a potential cancer. So our first patient is a 50-year-old man. He comes in with all those vague symptoms we just talked about, but he has one very specific and frankly very worrying clue: a painless lump in his neck that is growing, and it's growing fast. And this is where we get our first piece of hard data. The lab results come back, and his hemoglobin is low. That means he's anemic, which definitely explains why he's so tired. But the real clue here is that LDH number. LDH is an enzyme that leaks out when cells die off. A number this high, that's a huge red flag for rapid cell turnover, something you see in really aggressive cancers. So they do a biopsy. They take a tiny piece of tissue from that lump and look at it under a microscope. And that confirms the worst suspicion. The diagnosis is diffuse large B-cell lymphoma, or DLBCL. Now, this isn't just one tumor you can just cut out. This is a fast-moving cancer of the immune system that's already systemic, meaning it's all through his body. Okay, now I want you to hold that case in your mind as we turn to case number 2. You're going to see her story starts with that exact same puzzling set of symptoms. But there's one tiny, almost hidden clue in our file that's going to send us down a completely different road. Our second patient is a 48-year-old woman. She's got the same laundry list of problems: the fatigue, the weight loss, the swollen lymph nodes. But there's one small difference in her case file: a nagging, low-grade fever that just won't go away. It seems like a minor detail, but it turns out to be absolutely critical. Her first lab results come back, and it's like deja vu. Low hemoglobin? Check. Sky-high LDH? Check. It looks like we're heading down the exact same path. But this time, the detectives dig a little deeper. They test for a specific inflammatory protein called interleukin-6, and her levels are off the charts. And then she tests positive for a virus called HHV8. These are the game changers. And that leads to a totally different diagnosis: multicentric Castleman disease. Now get this, it looks like lymphoma, it acts like lymphoma, but it's not cancer. It's a rare disorder where the immune system itself just goes completely haywire, driven by that IL-6 protein, causing a massive, out-of-control inflammatory response that makes the lymph nodes swell up. So, we've unmasked two totally different culprits. One is a cancer, the other is an immune system in overdrive. And now we get to see why that distinction means absolutely everything, because it leads to two completely different battle plans for treatment. Okay, this slide right here, this is the whole story in a nutshell. With DLBCL, the enemy is cancer, cells dividing uncontrollably, so the goal is simple: destroy those malignant cells. But with MCD, the enemy isn't the cells themselves, it's that inflammatory protein, IL-6, that's causing all the chaos. The goal isn't to kill cells, it's to block that protein and just calm the immune system down. So for patient 1 with lymphoma, you have to go on the offensive. You bring out the big guns: aggressive systemic chemotherapy. The standard treatment is a powerful cocktail of drugs called R-CHOP, and it's designed to hunt down and kill cancer cells wherever they're hiding in the body. And this is why other treatments are just off the table. You can't just watch and wait when a cancer is moving this fast. And since the disease is systemic, it's everywhere, You can't just cut it out with surgery or zap a single spot with radiation. A body-wide problem needs a body-wide solution. But for patient 2 with Castleman disease, giving her chemotherapy would be like using a sledgehammer to fix a watch. It's the wrong tool for the job. Her treatment is so much more precise. It's a targeted therapy, a drug that goes in and blocks that one rogue protein, IL-6. It basically shuts off the fuel for the fire. And for her, other options don't make sense either. Surgery's impossible when lymph nodes all over the body are swollen. And steroids, well, they might cool things down for a bit, but that's just a Band-Aid. They don't fix the underlying problem. You've got to go after the source, and the source is IL-6. So, we've cracked the cases. The culprits have been identified. What's the big lesson here? What did all this detective work really teach us about the incredible power of a correct diagnosis? You know, it really all comes down to this single idea. The symptoms, the way the patients first appeared. That was just the surface. The real story, the one that decided life and death, was hidden deep inside their blood work and under the microscope. So let's just quickly recap our key takeaways. First, and most importantly, symptoms can be an incredibly misleading clues. Second, it's that deeper dive, the specific lab tests, the biopsies, that points you to the real culprit. And that leads to the biggest point of all: an accurate diagnosis is the only way you get to the right treatment. Getting the right answer, it literally changes everything. And that leaves us with one last really fascinating question to think about. As our diagnostic tools get better and better, how many other conditions that we think of as a single disease today will turn out to be completely different illnesses, each one just waiting for the right clue to unlock its own specific cure? Thanks for digging into this with me today.